Good morning, and thank you for coming today. I'm New York State Attorney General Eric Schneiderman, and I'm very proud and pleased to be here at Rochester City Hall to talk about a life-saving public health initiative. And joining me today in this project that truly will save lives are your great Mayor, Lovely Warren, Rochester Police Chief, Michael Ciminelli, Brighton Town Supervisor, Bill Moehle, Brighton Police Chief, Mark Henderson, and Senator Joe Robach, Assemblymember Harry Bronson. I think we have county sheriffs here as well, and Chief Deputy and Senator Ted O'Brien. And let me say something particularly about our colleagues in the Senate and the Assembly. We're here to talk about a program to make a wonder drug called naloxone available all over the state of New York to law enforcement. My colleagues in the legislature have already passed a bill that would even open the doors even further to making it more widely available, and we're hopeful that the governor will sign this. I believe we're also joined here today by Chief Deputy Jerry Brewster of the Criminal Investigations Unit of Genesee County. Is that correct? Someone from Genesee County. So we also finally are joined by a concerned mother and fighter in this struggle to deal with the epidemic of heroin abuse, Lori Drescher, whose son has been battling addiction off and on for 5 years, who has, in fact, overdosed and is now in rehab. He did not die, but he came close, and Lori is a leader among the family members who are organizing around the state so that we can prevent further tragedies, and I thank her for being here today. We're here today to announce that the Rochester Police Department and the Brighton Police Department are joining our office's program that is called the Community Overdose Prevention, or COP program. We are equipping police departments and law enforcement agencies all over the state with naloxone, which is a drug that prevents people from dying from heroin overdoses. The fact that we have these two great police departments joining us today is a big addition, and we have agreed in the COP program that we will reimburse, the Office of Attorney General is going to reimburse any law enforcement agency that wants to have naloxone available. It is, we're providing the Rochester Police Department with 30 kits for a pilot program in the northeast part of the city where there have been a number of heroin-related incidents, including overdoses. And we are also awarding the Brighton Police Department $2,600, which will pay for 40 naloxone kits so that every police officer on the Brighton force can be carrying them. We've also announced that the Wyoming County Sheriff's Office and the Genesee County Sheriff's Office have received COP program funds so that their officers will be carrying naloxone kits. And I want to acknowledge the local leaders here today for their setting an example for others around the state. We are at the beginning of the first round of reimbursement awards for naloxone. So far, in a few weeks since we announced this program, 107 law enforcement agencies have requested 3,400 kits. We are funding all of them. We have dedicated $5 million of funding for this program, and it is money that we recovered in the joint federal-state investigations, most of which comes from drug dealers, in fact. So it's very appropriate that it is being used to save lives that are threatened because of the drugs that these people deal. It will cost police departments nothing to have these kits, and that's what the COP program is all about, and we're proud that in this area of the state, more than in a lot of others, our law enforcement and local officials are taking advantage of this. It is clear that we have a heroin epidemic in our state, and I know, speaking to my colleagues from the legislature, that there have been hearings and they're looking at legislation to deal with this, but we need, ladies and gentlemen, to deal with an epidemic like this with what in criminal justice we call an all-levers approach. 2 weeks ago, I was here in Rochester when we shut down two massive intertwined narcotics rings in an operation called Operation Crazy Train that was moving huge quantities of heroin and cocaine into Western New York. It resulted in 32 arrests and the seizure of $1 million worth of heroin. That's one of the levers. We have to disrupt the supply. We're doing that. In New York State, we've also reformed our drug laws so that treatment is more available to users and that kingpins face stiffer sentences. Treatment is more widely available now than it has ever been. We are bringing down our prison population while we bring down the crime rate in most parts of the state. But the heroin epidemic is a threat to our progress. We also have enacted, and we're the only state to have it, the I-Stop program, because a lot of people get hooked on prescription drugs who would never start out going to a heroin dealer and then find they have an opioid addiction because they believe what you get from a doctor won't hurt you. Well, it can. And under the I-Stop system, you can't get multiple prescriptions for opioids anymore in New York State. In the first 8 months of the program, the Department of Health has reported a 75% reduction in doctor shopping. So all of these things are important, and naloxone is another important tool in another lever we can pull. This drug prevents death. We had a pilot project in Suffolk County from 2012 to 2013. 107 lives were saved. It used to be only administered intravenously, and that was a challenge because law enforcement officers and others were not equipped to do that in the field. It now can be administered through a nasal spray. A kit costs about $60. The training takes a half hour. In this part of the state, thanks to your officials and your law enforcement leaders, you're going to be saving a lot of people's lives and getting them into treatment. And I'm very proud to be here with you today and to be standing with these great leaders in government. And now I want to turn things over to one of them, your great city mayor, Mayor Lovely Warren.
I know all too well what drug use and drug abuse and how it affects a family and can affect a family. Loved ones want to do all that they can to save their child, their parent, their friend. And sometimes what they do is not enough. This particular program gives us the opportunity to at least be able to save lives. I am thankful for all the elected officials and members of law enforcement and our fire department that join us here today. I want to acknowledge our City Council President, Loretta Scott, as well as Councilmember Michael Patterson for joining us as well. We've heard about what's happening in our city around heroin use and abuse. This is something that is on the rise. We want to do everything that we can to equip not only our police department, but our fire department has been working very, very hard to save lives already with this particular drug. I thank the Attorney General for allowing us and supporting us in this particular project because we want to do what we can as a municipality to make sure that our citizens are taken care of. We believe that this particular project will give us the opportunity to save a number of lives. We've seen in Northeast Rochester, especially, that heroin use is on the rise. It has really affected many people, and our fire department has saved a number of people thus far with utilizing this particular drug. And so we want to thank them for their service. We also want to equip our police department with the tools that they need to also be able to save lives when they encounter it. And so today is a happy day for me because, as I said, I understand what drug reuse can do to not only a family but to individuals. This is a sickness, and we need to be able to help our people that may want to help themselves but just can't at this point in time, that don't have the resources or the ability to say no. This drug use can be something that can destroy not only families but individuals. And if we can do anything as a community, as a municipality, to save people, we're going to do that. And so I thank the Attorney General for thinking about Rochester when he implemented this program, but I also want to thank our state legislature for their leadership on this issue and trying to make this available even to parents and family members so that they can be equipped with the tools to at least save other people as well. Thank you.
Thank you. Thank you, Your Honor. And now we're going to hear from Chief Ciminelli.
Chief. Thank you. Good morning, and thanks for being here. I'd like to add my thanks to Attorney General Eric Schneiderman and the legislature for making this life-saving capability available to us. As you've heard already, the Rochester Fire Department has had a program to administer this particular drug, and they've done it successfully. So we're going to have a pilot program issuing it to 30 police officers in addition to the fire department to see if this is going to give us value added to expand the program to the rest of the department. As the mayor mentioned, heroin use is on the rise, and we're very grateful to have this ability to perform a life-saving function in addition to the law enforcement function, because the most important thing we do is save lives and try to enhance the public safety. So on behalf of the Rochester Police Department and the City of Rochester, we thank the Attorney General for these efforts, and we look forward to participating in this program. Thank you.
Thanks a lot, Chief. Thank you, and it is important to note that the heroin epidemic is not limited to one class or one part of the state or one area. It is urban, it is suburban, it is rural, it is in rich, poor, and middle-class communities, and this is why it is different than anything we've ever faced before as far as a wave of heroin addiction goes. And with that, I'm very proud that we also have here with us today, and we're now going to welcome Supervisor Moehle.
Thank you very much. I want to thank the Attorney General for being here today and for taking the initiative on this very important issue. As he said, sadly, in this day and time, heroin and other opiate use does not respect municipal boundaries. It does not respect socioeconomic or other barriers. It is a concern throughout this community and throughout the state. We have the opportunity with this grant to equip all 40 of our uniformed Brighton police officers with this life-saving drug. We hope we never use it, but we want to be prepared in case the need arises. We take a tiered approach to public safety and emergency medical service in Brighton. We do have an intermunicipal agreement with the Rochester Fire Department, where the fire department is providing fire service to a portion of our town. We have ambulance service through Brighton Volunteer Ambulance, but this grant, which will cover not only the drug itself but training for use of the drug, will enable us to protect as best we possibly can should we have an overdose in the town of Brighton. So again, I want to thank the Attorney General. I also do want to thank the legislature, particularly Senator O'Brien, Senator Robach, Assemblyman Bronson, who are all here today. The work you are doing on legislation will also help tackle this very serious problem. Thank you all very much.
Thank you. And now we're also very, very happy that we are joined by the Police Chief Henderson, who's now going to speak to us.
I'd like to echo the comments of Supervisor Moehle from a town of Brighton perspective. Thanks to the Attorney General for allowing us to add a tool to our toolbox. The Brighton Police Department is part of a first response matrix. We respond to calls, medical calls. Sometimes we're the first there. And if we don't have a tool, it's really difficult to save a life. And this tool will allow us to save lives. And thanks to the Attorney General for allowing that to happen for our members at the Brighton Police Department.
Thank you.
Thank you.
Thank you very much. And finally, as we deal with this epidemic and we organize to put more resources, to be more creative, to pass legislation, to enact programs, the organizing depends not just on public officials, but it depends very much on families who have experienced the heroin epidemic, people whose loved ones have been lost or put at risk, and the parents who take their own tragic circumstances and instead of retreating into privacy, come forward and join in this fight to prevent others from having these problems are heroes to me, and one of those is with us today, Lori Drescher.
Gosh, those are some big shoes to follow. Thank you all for inviting me to join you for this really important press conference. Thank you to the Attorney General and to Mayor Warren and to all of the community leaders and legislators that are here today as well. I'm very humbled to be able to join you here. I have just a few prepared comments, and then I want to tell you real quickly the way I view this issue through the lens of a parent. On behalf of the many families suffering from the opiate and heroin addiction, thank you for the opportunity to share my story. I believe I'm being called to present the human side of this crisis, which is bankrupting our families and killing our young. that by helping to dispel the widely held myths and judgments about this disease, we may begin to assemble a viable plan of attack. As a voice of the many parents who are unable to speak up, I do want to be clear that the views I'm about to express are my own. 4 weeks ago, my former husband and I received an email from our son that no parent ever expects to receive, that our son was considering suicide to eliminate the pain and shame that he was in because of his addiction to heroin. Fortunately, we were able to find him and to get him to a hospital that could medically treat him overnight while a mental assessment was performed. He was sent home the next day with a set of very complex detox instructions because no detox facility would admit him. And the hospitals are simply not equipped with the personnel, the training, or the medication to medically treat heroin addicts. What followed was 5 days of hell, detoxing our son at home, hours upon hours of research, pleading phone calls to insurance companies, detox facilities, and rehab centers. Because we were able to access the cash required to get our son the treatment he needed, our son's life is saved, if just for today. Sadly, many families neither have the financial resources or the advocacy skills to save their children in this way. I'm a business person besides being a mom. I tend to look at this crisis as a problem to be solved. I look for a logical root cause and a solution, very challenging through the added lens of being a mom of a heroin addict. From this vantage point, I see 4 primary issues, and all of them have been discussed here today. I'll show you the simple way that I take a complex problem and distill it into manageable buckets. And on my way, before I got here today, I thought, let me just draw this out in a diagram because that's how I tend to approach problems. And I'll hold it up really quickly, and I promise I won't take too long. There are 4 prongs. Number 1 is the disease model. We need to understand heroin and opiate addiction as the disease that it is. It fits the same criteria as every other disease, and yet we prevent the proper treatment from getting to the patients that need it desperately. Secondly, there's a significant business model, as the Attorney General probably knows better than anybody in this room. There's more than a $2.5 billion drug trade out there. And I applaud that you were able to siphon some of the profits from that business in order to fund our own naloxone pilot here in Rochester. There are a lot more proceeds from that drug that we should be using to fund the treatment for this problem. In addition, there are a lot of other people making money besides the pharmaceutical companies who make Suboxone and other viable treatments for heroin weaning impossible to get without health insurance. There are medical professionals who have a revolving door of addicts that create a financial annuity by providing them with treatments well beyond their effective use time. There are also pawn shops out there who thrive on the culture of drug addiction. They gladly take the jewelry that drug addicts are forced to steal because of this addiction, and they give them very little cash. And so there is significant support on the street for addiction. On the other hand, there are very few treatment options that are viable. I spent 5 days really understanding what this requires. In order to increase our possibility of getting to 70% success, which is survival, long-term survival, we need minimum of 4 months treatment. 4 months. Do you know what insurance companies are doling out? They're on average doling out 10 days, 10 to 14 days. It's not going to work. They spend 1.5 cents of every dollar on drug addiction and recovery treatment. Fourth is prevention and education. We need to educate our schools, our politicians, our clergy, our doctors, our counselors on how to effectively prevent the substance from ever getting to the addictive mind. So very simply, those are the 4 primary issues. I hope to help solve this problem. I can't do it alone. I need your help, and I need everybody's help in this room. Thank you for giving me an opportunity to speak.
Thank you, and thank you all. This is an epidemic that requires all of us to work together, to pull together, to be as creative and aggressive as we can be. And working together, this is a problem that we will solve. Thank you, and